So I'm Julia, and this is my colleague Karen. And we're just going to check this one. So thank you to ICON for giving us the opportunity to present this work today. So we're here on the behalf of the Society for Orthopaedic and Trauma Nursing, which is the Royal College of Nursing Forum in the UK. We're going to present to you today a project undertaken to review and update the competence framework for orthopaedic and trauma practitioners in the UK. And this is a talk really continuing the theme of some of the talks we had this morning, which talked about education and the specialist nature of orthopaedic nursing. So the aims of this talk are briefly to outline what we mean by competence and why we need it. We're going to give an overview of why we felt we needed to update the current framework, which was published in 2012, and discuss the process throughout, which is how we developed it, looking at the method, the functionality, who's going to be using the framework, and talk a little bit about the learning contracts, which are part of the new framework. So the standards of competence for registered nurses produced by the UK Nursing and Midwifery Council states that requirements that nurses must meet when they qualify, and also the standards that you need to maintain when you're a qualified nurse. But these are generic and do not discuss anything to do with the specialist nature of where you're working. Effective nursing practice, as we all know, requires the application of complex combinations of knowledge, performance, skills, attitudes, values, and the ability in the specialist area in which you work. So Benner in 1984 situates competence somewhere in the continuum that runs from novice to expert. So competence sits somewhere in the middle. And what the Orthopaedic Competence Framework allows is an assessment of competence and skills and knowledge that verifies a nurse's ability to practice safely and effectively in an orthopaedic setting. But really, we should be looking to go further than this. We should be striving to be more than just competent and look at ways that we can deliver excellence in our care. Our patients and their carers expect a nurse not just to be competent, but also to deliver excellent evidence-based, up-to-date care to give patient quality outcomes. So the original competence framework had 5 competence domains, seen here, which focused on the core activities of orthopaedic nursing. And these were verified through focus group research and resulted in the publication of the original document in 2005. This publication in 2012 was based on further research by Judd, Jester, and Santi, which reviewed the competence framework with the aim of adding to the specialist nature of orthopaedic nursing. And this amalgamated the coordinator section into the partner guide domain, reducing the total number of domains now to 4. And these 4 domains remain the backbone of our new document. We all know it's important to have a framework that underpins what we do as orthopaedic and fracture trauma practitioners. It's also essential that it's up to date and based on current evidence, hence the reason for our new piece of work. The new document has relevance to all practitioners, all ages of patients, and in different healthcare settings. So we linked the new document to the UK Nursing and Midwifery Code, and this is from our governing body in the UK. It's based on 4 broad standards that we should prioritise people, we need to practice effectively, we should be preserving their safety, and we need to promote professionalism and trust. The NMC code is current, is relevant to nurses for their revalidation, and familiar to all UK practitioners, and it sets out the standards of care that patients and the public expect. So it really made sense to use this document, which is current, produced in 2015, as a basis for our competence framework. The format of the framework starts with an explanation of the new document, as has been seen here, and lists the 4 competencies. The development of the competence framework was a 2-year project, and the work started with a literature review, and we then divided the domains up amongst the working group according to people's expertise and their preference. The main challenge was trying to incorporate all the practitioner pay bands across the whole lifespan of the patient. So our aim is for the document to be meaningful and to be used in practice in the vast range of settings wherever an orthopaedic or fracture trauma patient is cared for. The new framework is for everybody. It's for the practitioners, crossing the spectrum of healthcare assistants to senior nurses. It's for the employers and the managers and the patients, providing clarity of what to expect from an orthopaedic and trauma practitioner. And it's for the public, and it can be used to benchmark against other hospitals and it is there to ensure safe and effective practice. So it's a busy slide, and I don't expect you to read it, but it gives an overview of how to use a framework. So shown here, the statements come under headings of skills and behaviours and knowledge and understanding. The plus sign indicates inclusion of the previous statement. So for example, a Band 5 practitioner, which is a newly qualified nurse, would be able to undertake everything in Bands 2, 3 and 4, plus the additional competence levels under the Band 5 column. Using the framework clarifies when you might put the framework into action. And then it gives you some suggested evidence of how you can verify your competence. So if you just look through here, you can do self-directed study, you might do some reflective practice, you could write a paper for a publication, you could look at policy and protocol development. It's just some ideas to give you. And I'm going to hand over to Karen for the next stage.
Thank you. So we thought it would be helpful to show a draft layout of a domain, and we've chosen the technician domain here, which is domain 4. Again, this is another busy slide, but it's really to give you an idea of how we've laid it out. The statement will appear at the top, and the competencies are listed underneath. There are a different number of competencies within each of the domains. So this shows the types of technical knowledge and skills that a trauma and orthopaedic practitioner might require. And whilst the box is not all-encompassing of every technical aspect of orthopaedics, it does outline the majority of them. So this shows an example of a learning contract for a Band 5. That's a newly qualified or a new to orthopaedic staff nurse. And we've chosen the risk manager domain for this. The practitioner has chosen competence 1 out of that domain, and which is recognising potential risks and complications associated with the MSK conditions, injuries and treatment interventions. The learning contract details the specifics of what the practitioner aims to learn, i.e. evidence-based approaches to assessing a patient's risk of falling. And then across there will be how they will approach the learning and prove their increased knowledge. The last 2 columns are for the practitioner's manager or mentor to comment on the nurse's achievement and then to sign it off. These contracts can be used by practitioners within their appraisals or personal development plans, and also for revalidation with the Nursing and Midwifery Council, which we have to undergo every 3 years. And this slide is just to show you examples of the types of evidence that a practitioner might use, but there is a wealth of evidence that they can choose from. So the draft competencies were taken to the Royal College of Nursing Congress last year to raise awareness and engage practitioners in discussion in order to acquire feedback from them. The competencies were welcomed, and it was suggested that a draft document be piloted across all of the NHS bands of nursing and the 4 UK countries. And this slide just shows the comments that we received when we undertook the pilot. The production of the new document is the result of work undertaken by a group of nurses, academics and a physiotherapist working in different settings, and to ensure inclusiveness, they came from all over the UK. We thank our 2 critical readers, Dr. Brian Lucas and Dr. Julie Santi-Tomlinson, and we also thank the support from our RCN Forum advisors, as well as Rebecca Jester, who proofread the final draft. They provided advice, accuracy, clarity, and writing expertise. This is the final version of our framework, which has now been published and was launched at the Royal College of Nursing Congress this week. We have to say that it is a relief that it is finally finished. We have endeavoured to cover the broad spectrum of orthopaedics across the lifespan and in all settings. The individual practitioner will appreciate that the framework is a tool to be used when they are taking the responsibility in demonstrating their competence or in identifying gaps in their knowledge and skills. Thank you for listening.